Good morning, everybody. Today we have Aaron Broomall, who is the Executive Director of Faith Community Pharmacy, another hidden gem of service in our community. Aaron, thanks for taking a few minutes with us.
Thanks so much for having us on. We appreciate it.
You bet. Well, maybe the first thing is to do is congratulate you in your role. You've been in there, I guess, a little over 6 months now or so, and as executive director. But maybe first of all, let the community know about what does Faith Community Pharmacy do? What is your mission, and how do you go about providing the services you do?
Yeah, thanks for asking. So Faith Community Pharmacy provides 100% free medication to those in Northern Kentucky who can't otherwise afford their prescriptions. Primarily, we deal in chronic disease states such as diabetes, mental health, heart disorders, COPD, and asthma, things such as that. We don't bill insurance, and so there's absolutely no cost that goes to the client. And typically, we treat people at 200% of the federal poverty level or below. During COVID, we've expanded our boundaries because we want to keep as many people out of the hospitals as possible. So we've waived some of that and expanded our boundaries so we can help as many people as possible during this time.
So what would typically that annual income be right now? Well, let's say prior to COVID, what would that have been maxed out at for someone as a family income?
Yeah, for a household of two, that would be just under $35,000 a year. So it goes up about a little under $1,000 a month from there. So family of two, 35,000, family of three, a little over 43,000, individual, a little over 25,000.
So we're really talking to those who are really, truly in need. And so all of these dollars, and I should say all the medications that you help them obtain, how do you get it? How do you get them? And why wouldn't you want to bill Medicaid or private insurance if the individual happened to have it?
Yeah, that's a great question. So the vast majority of our medications are donated to us. There's an organization called AmeriCares, which kind of acts as a clearinghouse for medication manufacturers. When they have excess stock or they have short-dated products that are going to expire too soon for them to be able to sell them on the market, they'll donate them to AmeriCares, and then organizations like ours, free and charitable clinics and pharmacies, can go on and claim them. And AmeriCares actually sends them to us for free. So there's even no shipping cost. We get some from some especially high dollar items that are too expensive for us to purchase. We will get from samples from doctors' offices. Usually not enough to keep in stock all the time, but when we have that one-off of a client that really has to have Eliquis and there's no other way to get it, and that's a drug that costs $400 a month and we can't get through AmeriCares, having those samples really goes a long way. And then we spend about 25% of our budget every year purchasing generic medications that we can't get through AmeriCares. So that's the places where it comes from. This year, we expect to give away about $4 million worth of medications.
That's amazing. And so someone who is in need because they don't have access to other resources for medication, how's that been impacted here with COVID? What do you see the big change there?
Yeah, it's been crazy. We've seen our numbers go up 33% over 2019. So to put in perspective, we've found almost 200 new clients since the middle of March. Last year, we had a little over 400 new clients for the entire year. So just people coming in from all over. I think the most unique thing that we're seeing is we're starting to see some younger kids that need help, that parents got laid off, lost insurance, weren't able to get on Medicaid fast enough or K-CHIP, and they just needed somebody to get them that immediate next day they could get medication so that their kid could be okay until they could get covered by insurance. Some of the most surprising things, we've seen people pull up in Cadillacs that were doing just fine, and all of a sudden they lost their job, lost their insurance, and they're diabetic. And they go to get their diabetes, they go to get their insulin filled, and they find out it's going to be $800, $1,000, and they just don't have that. And so we're able to be that safety net for those individuals. It's definitely grown a lot. It's been heartbreaking, but it's also been really grateful that we have a resource in Northern Kentucky that can step up so that we're not seeing people just not taking their medications.
And go back to the mission of the organization. How do you operate in terms of funding?
Yeah, so we get about 40% of our funding from the fiscal courts. Thank you very much. They use their mental health grants and their agent grants to support us, and those are huge, especially for our clients in Boone, Kenton, and Campbell County. We also get grant funding from multiple different sources. We have fundraisers each year, which this year, just like every other nonprofit, it's a big concern. That's about a little over 30% of our funding, that it's a giant question mark right now where that's going to come from. And then we have private donations.
So that key to the community of filling that need, do you have a reserve that you feel comfortable getting through until hopefully the amount of numbers that you're getting as an increase start to go back to normal? Can you weather the storm?
Yeah, thankfully, previous leadership of the organization and our board of directors did a very good job at keeping a cash reserve. So obviously, the longer it goes on, the more difficult it is. And I think that's the question mark that everybody sees. The question mark is, how fast are we going to continue to take in new clients? But we're going to be here one way or another. We're going to be here because the community needs us, and we'll weather it and we'll figure it out. And it's important. We have to be here.
So Aaron, if you, in today with this huge increase, or whatever that percentage is, once we get to the end of this year and hopefully into a time that COVID is being treated or have a vaccine available, do you see the individual? What happens and how often do you see a client who you just can't get the medication to them? And then what do they do after that if you literally cannot get access to what they need?
Yeah, that's a great question. So our goal here is to provide 80 to 90% of medications. That's really what we try to do. And then we hope that the savings that we offer off of that will be able to compensate for the medications we can't cover. But if somebody does have a medication that we can't cover, for instance, Eliquis is just a great example. We can't get it through AmeriCare for free. It would cost us $400 per month per client, and we just don't have the money to do that. So under those circumstances, a lot of clients will go to their physician and ask for samples, and that's kind of the best fallback. The difficult part during COVID has been that drug reps haven't been visiting doctors' offices, and doctors' offices have been closed. So those samples have really fallen out, which is how a lot of people have found us in the first place. They can't get samples anymore, and so they've come to us, which is probably a better solution anyway, because we can be a long-term solution rather than having to go back each month. But if not that, we still see people going without their medications, or putting on credit cards. We had a family not too long ago that had simply maxed out their credit cards trying to get medication, and it's heartbreaking. We are in the process of creating a fund. We started partnering with St. Elizabeth and Humana to work on the details of developing a fund. Most of our clients do have prescription drug insurance. They just can't afford their deductibles. If you have Medicare, it's $435 out of pocket before you get your first pill. And our average clientele makes a little over $21,000 a year for a family of two. So they can't afford $430 before they get their first pill. But what we're working on is creating a fund where maybe we can work with their insurance and other pharmacies where we could use that to cover copays and deductibles to make it manageable for us to be able to help.
Well, it's obviously very obvious that your organization has done great work in the past and continues to do that. And thank God that you're one of those safety nets in the community to help provide that service. So looking forward, any thoughts or anything that makes you either feeling good or feeling bad about the next 6 months or a year for Faith Community Pharmacy?
I'm actually really excited. When I came on board, Faith Community Pharmacy has been a great pillar since 2002. And one of the things that I saw when I came on board is we just needed to update technology, and we needed to break down barriers of entry for clients. We're located in Florence right now. That's a difficult situation for people to get to if they're impoverished. And so just since COVID started, we put in a lot of new technology to allow almost all of our processes to be paperless now. And we're working with our other nonprofit partners across Northern Kentucky, such as the Brighton Center, the Emergency Shelter, and a number of others that would allow them to register their clients for our services And that would eliminate that client ever having to come to Florence. We've also adopted mailing medications, which we've never done before. We're working with partners such as St. Vincent de Paul and Meals on Wheels that are doing deliveries to some of our outreach locations. I am very excited that we are really working hard to, more than ever, to ensure that anybody that needs help can get access to our services, regardless of where they live in Northern Kentucky, regardless of their access to transportation, regardless of their health condition.
Well, it's obvious that the board made the right choice when you came on, and filling some big shoes, I know, of your predecessor. So I know that they're in good hands, and we appreciate the great work you're doing. And I appreciate the time you've given me this morning. And I know everyone can reach out if they feel a need to support or would like to be or so inclined to support the organization moving forward. But thanks so much for the time.
Thank you, Kris. Thanks for taking the time, and thanks for everything you're doing to bring awareness to our community. I've been watching your shows and your short clips, and it's been fantastic. Thanks for being a great leader.
No, you're very kind. Thanks so much. Take care.
You too.